Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. The topic which we are going to discuss is psoriasis. Psoriasis is a patchy discoloration of skin. So basically, there will be discoloration on the skin in the form of patches. So it normally occurs to the 1 or 2% of the population in their second or fourth decade. It means in their 20s or 40s. Though it occurs in all the ages, mostly we see in 20s and 40s. So basically, it's more than a skin disease. It's an autoimmune disease. So it is a systemic disorder. So that is a problem with this disease. So it is not confined to skin. It may attack your kidneys, or it may attack your thyroid glands, or it may attack your intestine or blood. Any other autoimmune disorder, you are prone. Autoimmune disorder means, so normally what happens if there is a bacteria or virus or protozoal infection from outside, so your body immune system has to react against it. In autoimmune disorders, what happens is, so your body will act against your body cells rather than against the outer cells or the pathogens. So this is the autoimmune disorder. The main problem with the psoriasis is it's a social stigma. So when someone sees patchy discoloration of your skin, so they are scared to touch you, or they are afraid to touch you. That's an embracing moment. Even the own family members doesn't know that it is not a communicable disease. Though it doesn't communicate from one person to another person, it is purely a genetic disorder. Most of the people think that it may spread. That is the social stigma, even though it is non-infective. The one more thing is mate value of a person will be decreased. What is mate value? So if you think as a man or a woman sexually, you have a particular value, so this disease can reduce your mate value, can lead to disruption of marriages or disruption of relationships. That is a main problem. One more serious condition for this is, for about 10 to 20% of the patients, what happens is within 10 years of getting the skin lesions, they may land into psoriatic arthritis. This psoriatic arthritis, sometimes it's simple, just pain in the small joints. It occurs in bigger joints as well, normally in the smaller joints. In serious form, the bone is completely degenerated. For example, if your finger is normally 5 or 6 centimeters, in serious cases, all the bones will be degenerated and it comes to only 1 centimeter. So that serious it is in some of the patients if it is not treated in a long term or after 10 years. Basically, the functional disorders, it weakens you functionally and also psychologically. Psychologically, you may undergo depression, you may undergo frustration. All the psychological disorders are seen. We look into symptoms and signs of psoriasis. So normally, sometimes, rarely, this psoriatic patches will be itching. Basically, these are erythematic patches. Erythematic means red color patches. These are well-defined papules, plaques, or pustules. So of various sizes. What is a papule? Papule is a small lesion less than 5 millimeters of diameter, and it is an elevated lesion. Sometimes we see that type of lesions. Sometimes we see plaques. Plaque is a lesion around 2 centimeters in diameter, but it is not elevated. It is flat, but it is discolorated. Pustules is a blister kind of a lesion. In some cases, psoriasis is expressed as pustules as well, where it seems to be a blister. Next stage, what happens is, you will find dry scales on the skin, on the lesions. Those are dry. These scales are loose, they are abundant. These are silvery white or micaceous. Micaceous means, so we know mica, right? It is one of the classical features of psoriasis. It looks like mica. When you remove the scale, or when you shed the scale or scrap the scale, it becomes red, it becomes moist, and it may have micro bleeding. So these are the symptoms of psoriasis. So what are the investigations that needs to be done for the psoriasis? To detect psoriasis, skin biopsy is needed. So what happens here is, a small portion of the psoriatic skin is cut and it is taken out. It is sent for the histopathological examination for a laboratory. There you find immature keratinocytes, so or huge number of keratinocytes with nucleus, prominent nucleus you can see under microscopic observation. This is the skin biopsy is the main investigation, but other investigations you have to regularly do are related to other autoimmune disorders, like so thyroid disorders, or when it attacks pancreas, so regularly you have to check your sugar levels or hemoglobin. It sometimes attacks your red blood corpuscles also when it is autoimmune, and also intestine for Crohn's disease. So these are the various tests you have to do regularly for if you are a psoriatic patient. Screening for other autoimmune disorders is the main thing in psoriasis. In order to understand the pathology of the psoriasis, we need to understand normal structure, normal histology, and normal physiology. I think there are three layers in the skin. The top layer is called epidermis, Middle layer is called dermis and lower layer is called hypodermis. In epidermis, that is upper part of the skin, again there are different layers. So in that there is a basal layer. That basal layer is very important to us because this layer produces keratinocytes. So keratinocytes is produced by this layer. Normally what happens is it has a 21-day life cycle. So within 21 days the keratinocytes move or migrate to the upper layer of the skin, and they mature there. What is meant by maturation of keratinocytes? So they lose their nucleus, then we can say it is matured. They are multiplied in basal layer of epidermis. They take 21 days to come to the surface of the skin. By the time they come to the surface of the skin, they mature and they lose nucleus. This is the normal anatomy, histology and physiology of skin from the perspective of psoriasis. What is the etiology? What are the causes for psoriasis? It can be genetic or acquired. So if any of your family members or first degree relatives has psoriasis, in winter, some of the patients get triggered this in winter. So emotional stress is one of the main reasons. So when you are under emotional stress, cortisol is released. Cortisol has ability to multiply this psoriatic or keratinocytes. So depression, if you are in depression, again cortisol is released. This is the pathology. Focal infection, if there is any infection on the skin, it may trigger psoriasis. Pregnancy is also one of the major causes for psoriasis. Even in pregnancy you may trigger psoriasis. Upper respiratory tract infection, especially streptococcal infections. If you are infected with streptococcal bacteria, you are more prone to get psoriasis. So some of the drugs, such as the drugs which are used for controlling the BP, like beta inhibitors, beta blockers, are a major reason for psoriasis. NSAIDs, non-steroid anti-inflammatory drugs, or painkillers. You regularly go to medical store and you get them for reducing the pain. These are one of the reasons for triggering psoriasis. Withdrawal of steroids. What is a steroid? Steroid is an immunosuppressant. So for any reason, if you have used a steroid for a long time and you have stopped it suddenly, what happens is it will trigger the psoriasis on the skin. So some of the antibiotics, even antibiotics are known to produce triggering factors for psoriasis. So metabolic syndromes, if there is metabolic syndrome is diabetes, hypertension. So if you have the metabolic syndrome, even that is causing the psoriasis. Cardiovascular diseases, even obesity can trigger the psoriasis in some cases. Now understood the normal structure of the skin, normal physiology of the skin. Now we look into pathophysiology of pathology. It means what are the changes in the body that will occur when you are having psoriasis. Psoriasis is an autoimmune disorder. What is an autoimmune disorder? Normally, if a parasite or if a protozoan or any bacteria or virus comes into your body, our immune system should act against it and defend us or kill the pathogens that are coming from the outside. In autoimmune condition, what happens is your body cells, your body immunity is going to attack the normal cells. In this case, what happens is the immune cells within our body are going to attack the keratinocytes in the epidermis of the skin. That is a major reason for psoriasis. What happens is normally it will take 21 days for keratinocytes from the basal layer to move into upper layers and lose the nucleus. Here what happens is they will move within 3 to 5 days. Instead of 21 days, they will move within 2 to 5 days, and also they will not mature. Not mature means they will not lose the nucleus. They will still have the nucleus, and these we call them as immature keratinocytes. On top of it, redness, swelling, itching and burning are due to the inflammatory mediators around the basal layer, around the keratinocytes. When immune system attacks, it will release some immunomodulators or inflammatory mediators. So this is the cause for redness, swelling, itching and burning in the case of psoriasis. There are different types of psoriasis based on the pathology. One is guttate psoriasis. Guttate psoriasis you get when there is streptococcal infection of the throat. When the throat is infected with streptococcal bacteria, what you see in this type of psoriasis is you see papules around the trunk, around the abdomen or back, around the abdomen. So these are the papules. Papules are elevated structures from the skin. The lesions are elevated and these are less than 5 millimeters of diameter. So next is unstable psoriasis. Unstable psoriasis is a psoriasis when it is transitioning from guttate form to plaque form. This we call as unstable psoriasis. Erythrodermic psoriasis. Erythrodermic psoriasis is the most notorious forms of psoriasis. In this, what happens is from head to toe, not it will not even single inch of your skin. It becomes red, it becomes inflamed, it becomes painful, it becomes edematous. So this is a severe form of psoriasis which we call as erythrodermic psoriasis. Next we have pustular psoriasis. In pustular psoriasis means what happens is blisters like lesions come on all the skin. So blister is when the skin is burned, so you will get a blister there. Such type of lesions are seen in this pustular psoriasis. One is generalized pustular psoriasis. In this, what happens is entire body is covered with this pustules or blister kind of lesions. Next one is acropustular psoriasis. In this, what happens is tip of the fingers, one or two fingers will get the pustular lesions. So it is also one of the most common ones. And next one is palmoplantar pustulosis. In this, what happens is your complete palms, both the palms and your soles are covered with this pustular lesions. This is one of the most painful form of psoriasis. There are other specified forms of pustular psoriasis as per ICD, International Classification of 11. Psoriasis, based on the distribution, we can classify it into scalp psoriasis, where the psoriatic lesions are seen on the head and a complete scalp. Nail psoriasis, this psoriasis attack the nails. There will be pitting sometimes, and onychlosis. Onychlosis is separating the nails from the nail bed. These are the forms of nail psoriasis. Flexular psoriasis. In this, what happens is wherever there is body who folds in the body, maybe in the axilla or popliteal fossa or any other fold, you will get this psoriasis. One more form is anogenital psoriasis. In that region, you will find the lesions of psoriasis. There are other specified and unspecified forms of psoriasis as well. So we will look into the conventional treatment in psoriasis. What I mean by conventional treatment of psoriasis means, so if you suspect psoriasis, you will go to a doctor nearby your home, or you go to a corporate hospital or to a dermatologist. So we call it as allopathic treatment. So we will check how damaging is this treatment to the people than compared to homeopathy, and why homeopathy is best treatment in case of psoriasis. So what is the treatment they have for psoriasis? The treatment they have for psoriasis is giving the steroids. One of the important forms is, maybe it is in local form or in the systemic form. Local form means they will apply some ointment, a steroid ointment, or systemic form means you will ingest the steroids. So what are all the disadvantage of steroids? Steroids basically suppress your immunity, so your body cannot fight against other diseases, so you are more prone to get infections in case of when you use steroids. And also one more thing, what happens here is, when you withdraw the steroids, this disease is going to rebound. It comes with more vigor, more power, more areas are involved, more severity of itching, burning and redness. So we see in allopathic treatment. So allopathic treatment is not good choice for psoriasis. We have much better treatment in homeopathy. This is cell multiplication, right? To reduce the cell multiplication, these guys use some of the cancer related drug, especially methotrexate they will use. So these cancer related drugs have a lot of side effects. Conventional treatment is not advisable in case of psoriasis, because we have better treatment in homeopathy. It will reduce the immune system, so immune system is compromised, you may get other infections, may severe infections or mild infections. So it is not good to get treated for psoriasis with conventional treatment, especially when they use steroids and drugs like methotrexate that are given for treatment of cancer. How well psoriasis can be treated with the help of homeopathy? So you know that there is a genetic cause and also triggering sources from outside. So external sources, acquired or genetic. Homeopathy can treat both acquired and genetic causes. See, any disease you get either from genes or inherited or from outside. Either way, or if it will be mostly the combination of both. In case of psoriasis, what happens is homeopathy has excellent treatment. We call it as constitutional treatment. When there is genetic predisposition, on top of it, you have external triggering factors. What will happen to your body is there will be changes in your physiology, means functioning of the body, and there will be changes in the structure of the body, your skin structure, and also there will be changes in psychological part of the patient. So physical changes, physiological changes, and psychological changes. By considering all these changes in homeopathy, we prescribe a constitutional medicine. So this constitutional medicine will cure the disease completely, will prevent the disease from progressing or reoccurring, and also in severe case psoriasis has a very good treatment in homeopathy. Mostly it will be cured and it will not reoccur when you take for the treatment for sufficient time. So it is safe. Homeopathy doesn't have side effects. Homeopathy is effective than compared to any other treatment, and also cost effective compared to any other system of medicine. Homeopathy can cure the disease, palliate the disease, or prevent the disease with minimum cost. So what is the reason why homeopathic medicines doesn't have side effects? Because homeopathic medicines prepared on the principle of nanotechnology. What is this nanotechnology? This is a specific form of creating homeopathic drugs. We call it as trituration and succussion. So suction is a homeopathic name for froth flotation. When you do trituration and succussion or froth flotation, what happens is nanoparticles are produced. These nanoparticles, see, the active ingredient will be in the center. It will be covered by lactose molecules. On top of it, it is coated by silica. So one active ingredient molecule surrounded by lactose. On top of it, it is coated by silicon layer. This we call as homeopathic nanoparticle. In the center of the nanoparticle, active ingredient is well preserved. Why it doesn't have side effect? The reason is, so if you take Ayurveda or if you take allopathy, any system of medicine, the medicines are given in few milligrams or grams. But in the case of homeopathy, we give medicines that contain only within a picograms. Picograms are a very small quantity, so these are target specific. They will hit only the target. They will not go off the target. Why do you get side effects when the medicine has to work only on a specific target? If deviates the target, if it has multiple targets, then you will have side effects. Homeopathy is going to hit only the target. There is no off targeting. That's the reason it will not have side effects. And also the quantity of medicine is used in a very small quantity, that is in picograms. That is the reason we don't get side effects. You may ask one thing, so how is it effective? So when the medicine is given in this much of small quantity, that might be your question. The answer for that is homeopathy works on the principle of hormesis. What the principle of hormesis says is, any substance, even including water or snake poison, anything, any substance you take in higher quantities, it kills the biological activity. In medium quantities, it inhibits the biological activity. In smaller quantity, it stimulates the biological activity. Take the snake venom. In higher quantities, it will kill a human being. So when it is taken in very minute quantities by the preparation of nanoparticles and used in small quantities in picograms as in homeopathic medicines, it is an excellent cure. So it works as an excellent cure for some of the diseases. In the same way, even for psoriasis, we give such type of small molecules or nanomolecules, nanoparticles in picograms, so that the principle of hormesis comes into play, and you will either cure the disease mostly, or you will prevent the disease than occurring. And very rare cases when cure and prevention is not possible, you will palliate. But in most of the cases in homeopathy, you can relieve your symptoms. So finally, homeopathy can cure the disease, homeopathy can prevent the disease, homeopathy can palliate the disease, and homeopathic medicines are safe, effective, and affordable. Especially in case of psoriasis, you can blindly use homeopathy. Come to a homeopathic doctor and you can take homeopathic medicines, so you will be cured. What are the precautions you need to take for psoriasis? Once the psoriasis is detected, so do not use soaps and detergents. Avoid them. If there is any infection in the body, especially on the skin, get it treated immediately. So you can do plenty of sun bathing or sea bathing. You can go to sea and you can enjoy there. Try to expose your skin to ultraviolet rays. This will decrease the psoriasis. Have regular checkup for other autoimmune. This is the most important thing. So as I said, this is not only a local skin disease, it is a systemic disease. So you have to watch out for other autoimmune disorders like thyroid disorders or pancreas, which is expressed in the form of diabetes, or intestinal disorders in the form of Crohn's disease, or any autoimmune red blood cells destructing diseases. You have to watch out for all these. So take plenty of fish, take naturally grown fish, especially don't take the fish that are artificially fed with corn and other supplements. Try to get naturally grown fish. Sea fish are good. Do plenty of exercises, lifestyle modifications, obesity and smoking. Diet you have to take. So you can take plenty of fish. Fish is good. Fish has EPA and DHA. Avoid dairy. Fish will suppress or decrease your psoriasis. So what type of diet you have to take? Take plenty of green leafy vegetables. They are rich in minerals, they are rich in vitamins, they are rich in fiber. So this is very healthy diet. Take plenty of nuts, plenty of pulses you can take. So apart from this, you can take good amount of non-vegetarian food, but very less quantity. Don't overdo the non-vegetarian food. This is the diet you have to take in psoriasis. And what type of exercises you have to do in psoriasis? So first exercise you have to do is aerobic exercise. What happens in aerobic exercise is it will regulate the glucose metabolism. It will decrease the insulin resistance. By these two things, you will regulate the glucose. And how to do the aerobic exercise? Aerobic exercise, you can walk briskly, or have you can take a swim, or you can ride a bicycle. But what is the intensity you have to do? The intensity is, so this we call as a zone 2 cardio. In zone 2 cardio, what happens is there will not be any huffing and puffing. So you will be breathing out and breathing in with your nose. There is no extra oxygen you will be demanding. In this, what happens is, here fat is the substrate for energy. So you will get the fat into the system, you will burn the fat, and you will produce the energy, so that you will become lean, you will become thin, and your metabolism is regulated. Next exercise you have to do is hit high intensity interval training. This is zone 4 cardiac exercise. In this, what happens is you go all out for 1 minute with high intensity, as much intensity as possible for 1 minute, and give the rest for 3 to 5 minutes. So here what happens is growth hormone is released and testosterone is released. Growth hormone and testosterone are very good hormones, anabolic hormones. They improve your immunity, they optimize your immunity, and you will be free of diseases. On top of it, you can do mid endurance duration means, so this is zone 3 cardio. In that, what happens is, a vague description of it is, you can inhale through nose and exhale through mouth. This is in between zone 2 and zone 4. This is called zone 3. In zone 3 exercise, you have to do for at least 10 minutes. You can do anything. You can ride a bicycle, you can swim, you can jog, you can do anything with zone 3. Zone 3 is a medium intensity. You will have huffing and puffing, but it is not as much as in zone 4 cardio. So here what happens is, your endurance is increased here, your cardiac parameters are increased here. So you'll have good stroke volume, and you will decrease the resting heart rate. These are very useful exercises in case of psoriasis. All these are directing to release of growth hormone, release of testosterone, increasing your cardiac health, optimizing your immunity. And what type of lifestyle changes you have to make? Stop smoking immediately, stop taking alcohol immediately, reduce obesity. And also, if you have any addictions, you have to come out of the addictions immediately. So in addictions, what happens is, your basic dopamine levels are decreased. Then you will not feel pleasure in any of the activities other than these addictions. So you have to come out of these addictions and lead a healthy life. There is no organ in the body or no system in the body that is affected by deprivation of sleep. If you deprive sleep, every organ, especially your immune system, is more prone to derangement if you don't sleep. At least 7 to 9 hours of sleep is essential every day. So how do you sleep? There are plenty of tips you can follow. So at least visualize sunlight 20 minutes in the morning, 20 minutes in the evening, so that your biological clock or your suprachiasmatic nucleus is set. So even though if you wake up in the middle of the night, don't watch the phone, because it will decrease the melanin synthesis. If you have sleep disorders, do not try to sleep in the afternoons, so that your adenosine will be at the peak in the evening, so that you will get good sleep. Stop looking at phone at least 1 hour before you sleep. Try to sleep at a regular time every day. Maybe if you are going to sleep at 10 o'clock, try to go to sleep at 10 o'clock every day. So by following these simple tips, you can improve your sleep. So diet, exercise, lifestyle modifications are very important in case of psoriasis. So have these habits. What happens if you don't treat the psoriasis effectively? So as I said, this is not a skin disease. This is a systemic disease where you have autoimmune derangement. So you can get Crohn's disease, or you can get diabetes, you can get a thyroid related disease, you can get intestinal related diseases, any other autoimmune disorders you are prone to get. Even though you get treated this psoriasis with allopathy, these disorders are not going to go, because in allopathy there are no drugs for them to reduce that autoimmune tendency. So if there is autoimmune disorder, they will suppress it. So until you take the drugs, they will be in control. When you remove the drugs, it will rebound. So there is no drugs for them to remove the tendencies. So same stress and same physiological factors you are exposing, another person is also exposing. What is the difference between you and that person? That is a tendency. There is no medicine in allopathy to remove that tendency, but in homeopathy we have very good medicines to remove that tendency of autoimmune disorders. One more serious form of psoriasis is psoriatic arthritis. When the psoriatic lesions are not treated with homeopathy for at least 10 years, within 10 years you will go into psoriatic arthritis. In psoriatic arthritis, mostly it will affect the small joints, your fingers and toes, mostly small joint, but also it occurs in larger joints as well. It will start from simple pain, redness, swelling, stiffness, or deformity. So this will be sometimes symmetrical, sometimes asymmetrical. Means you will have, if there is pain in little finger, sometimes will have pain in both little fingers, sometimes only in little finger. So these are the simple forms. In serious forms, what happens is your bone get degenerated, or your periosteum get degenerated. Bone is completely degenerated. Instead of your fingers having 6 to 7 centimeters, they will become 1 centimeter. So such a disruptive disease is this psoriatic arthritis. So in order not to land into all these disorders, homeopathy is the best medicine and you can make use of it.